Congestive heart failure is a condition where the heart becomes weak and is not able to pump effectively. It is also referred to as CHF. There are several causes for this condition, including coronary artery disease, high blood pressure or hypertension, heart valve abnormalities, toxins, and infections. Common symptoms of CHF are shortness of breath, which worsens with exertion or when lying flat, fluid retention, fatigue, and chest discomfort. While CHF can be diagnosed through a routine physical examination, oftentimes an EKG, a chest X-ray, or labs are required for a proper diagnosis. The treatment of CHF depends on its severity. Treatment can take place in an outpatient setting, or it may require hospitalization. CHF is treated through medications. You may have been given a dose of medication through an IV or by mouth in the emergency department. The purpose of the medication is to help the heart to pump more efficiently with less effort. In addition to medications, there are several steps you can take to make sure you keep your CHF under control. Limit the amount of salt in your diet. Avoid salty foods and adding salt to your meals. After your acute episode of CHF has resolved, and you're cleared to do so by your primary provider or cardiologist, begin an exercise regimen. If you smoke, it is essential to stop. Smoking can worsen your condition. Monitor your weight on a daily basis. If you gain more than 3 pounds in 4 to 5 days, contact your provider. Maintain your blood pressure within normal limits. If you have high blood pressure, you may require medication to do so. Monitor yourself for symptoms of CHF such as fluid retention or trouble breathing. Take your prescribed medications as directed. You will need to follow up with your primary provider as soon as possible. Contact their office to make an appointment once you leave the emergency department. At this point, it has been determined that it is safe for you to go home. You should notice improvement within the next 1 to 2 days. Sometimes there are some instances where there is no improvement with the standard treatments. Therefore, it is important that you contact your provider immediately or return to the emergency department if any of the following develop. Shortness of breath worsens or does not improve. You are not able to speak in full sentences. Fever, dizziness or lightheadedness, chest pain or chest discomfort. Your condition worsens. New symptoms develop.